I had gynecomastia surgery and clear color sutures are still there. Looks like they're inside of the skin. How will they disappear if they are tied? Yeah, so it sounds like they are dissolvable sutures. I don't know if you had it with me, but I do use clear sutures underneath the skin for gynecomastia surgery, and there is a risk that you might see them. You might see particularly the knots, and they will disappear because the suture literally dissolves. Now, so it doesn't matter that it's tied; it will disappear. It will dissolve. The problem is that the knots often take a bit longer to dissolve because they get dissolved by being in contact with water. And when you've got a knot, there's just water on the outside. So the inside can take a while. So sometimes the body kind of spits them out. So if it's been a few months since your surgery, and if it's a nuisance, it might be possible to remove it for you. But personally, I don't really do that, and don't really want to do that because usually it settles, and if it is a bit of a nuisance, it usually sorts itself out. And as I say, it will dissolve, but the knots take a little bit longer to dissolve. So there's always a balance when we're doing surgery as to how many throws we put on the knot. I don't know if you know what a throw is. Like if you tie your shoelaces, that's like one throw, you know. So when you do knots, sometimes you sort of do throw and then you do the opposite way throw. So that's when you're tying knots. So if you're doing something like really deep down, like for instance, the sort of thing that I would be doing would be something like tummy tuck, and I'm repairing the muscle, for instance, that's really deep down and that's really strong suture. So I do lots of throws on that knot, loads of throws, but then the knot's really massive. And then I try and sort of flatten it out so you can't feel the knot. Can be a problem in slim people, but obviously if it's deeper down, you're less likely to feel that knot. So it's more secure. So you're putting lots of throws on it. As you get closer to the skin, you put fewer throws on it, which makes it a less secure knot, but then makes the actual knot itself smaller. So you're always trying to do a balance. So traditionally it's a kind of three throws you put on a knot, particularly close to the skin. But as I say, there's a balance between making sure the knot doesn't come apart, especially these clear ones, because the clear ones I use are what's called monocryl is the name of the suture, which is kind of like a monofilament, which is like fishing line, which kind of like has memory, a bit springy, as opposed to the other sutures, which are kind of like white, which are called vicryl, which is like a shoelace, which is a braided suture, which doesn't have memory, so it won't ping. It's not like a fishing line; it's like a rope, and the rope one will grab and tie a knot a lot better. You know those ships. When ships get moored at the port, they have like big braided ropes. If you can imagine, if they had like fishing line attached to the docks, you'd be worried it would kind of give, or the knots wouldn't. I don't think they do attach by knots, but if let's just say they did attach by knots, it wouldn't be quite as good. I don't know if that the ship is a good one, but basically a monofilament suture like a fishing line doesn't grip as well as a braided suture like vicryl, like a shoelace. Shoelace kind of grips really well. If you imagine shoelaces were made out of nylon or like a washing line stuff, it doesn't grip as well. So you have got a balance between the two, trying to make the knot. I don't know if you can tell I'm on my last question. I'm trying to drag it out, trying to make the knot as small as you can, but you've got to be a bit careful with the monocryl because you don't want the knot to undo. That's the bottom line. So, but the benefit of monocryl, the benefit, if anyone's still with me, I don't know. Anyway, I might have lost the. Anyway, I'll carry on. The monocryl one, like a fishing line, is less likely to get infected because the one like a shoelace has got like little nooks and crannies that you can get bugs in. So the vicryl is a bit more likely to get infected, but will grip better. So will hold the knot better. So if the wound's under a bit of tension, so like for instance a tummy tuck, we're all different, but when you're closing the tummy tuck, often kind of when you're taking the tension off the wound, you'll use a braided suture like a vicryl just to take the tension off because it's gaping. and then once its tension's off and you're putting one in the skin, you use a monofilament because the tension's off, and you want to use a suture that's less likely to get infected compared to the Vicryl one. But with a gynecomastia, there's very little tension on that skin. So personally, I don't use Vicryl. It would be reasonable to use Vicryl. I use the clear one, the clear monocryl. But as I say, it's got memory, doesn't hold a knot so well. So you've got to be careful how many throws you put on it, because the more throws, the bigger the knot, and the longer it takes to dissolve. So that's how we came back to this. So what's going to happen? It's going to dissolve, but it has to dissolve from the outside in. So the bigger the knot, the longer it takes to dissolve. So yeah, but it will dissolve. Don't you worry, it will dissolve. But stay close with your doctor is what I say, because it can get infected while it's, because if you can see it, because presumably you can see it, because you're saying how will it disappear. So if you can see it, there is a concern that it could get infected. So I would say if I'm your doctor, stick close to me. I don't know if this is my patient, but if you are my patient, then you know, we need to keep an eye on things to make sure it doesn't get infected. Because if it looks like it's getting infected, we might have to remove the suture. Hopefully, it'll be long enough for the wound to have healed, because that's the problem. If it gets infected and it's not long enough for the wound to get healed, then you're in a bad position if you have to think about removing the stitch when the wound hasn't completely healed, because you worry it will open up. But these are all the problems that we face as surgeons who have potential issues and potential problems. But that's okay, because we are highly trained in the management